The myopectineal orifice, which has been described by Henry Frochot in 1956, is a well-defined weak area in the anterior abdominal wall that occurs in association with hernias in the inguinal, whether direct or indirect, and femoral region. The myopectineal orifice boundary consists of a lateral boundary of the iliopsoas muscle, the medial boundary of the rectus sheath, and rectus abdominis muscle superiorly as the arching fibers of the transversus abdominis and internal oblique muscles, and the inferior boundary as the iliopectineal line and the Cooper ligament and pecten pubis. Understanding and identifying the myopectineal orifice delineation are essential for surgeons in surgical repair. The inguinal anatomy should be identified during surgical approach both in open and laparoscopic techniques. It's important to note that the inguinal ligament will divide the region into two subdivisions. One of them is the inguinal region, which is a Hasselbach triangle, the origin of the direct hernia, the deep ring, which is the origin of the indirect hernia, and these are separated by the inferior epigastric artery. While the lower division of this region is the femoral region, which is passing the femoral artery and vein, and the femoral canal, which is a passageway for femoral hernia. The femoral hernia boundaries are posteriorly the pectineal ligament and pecten pubis, anteriorly the inguinal ligament, medially the lacunar ligament, and laterally is a femoral vein. Well, conceptually, we need to know that the Bassini type of repair, which will join the conjoint with the inguinal ligament, will control only hernias passing through the inguinal region, that's direct and indirect, while the repair between the pectineal ligament and inguinal ligament will control femoral hernias, while repairs including the conjoint tendon to the pectineal ligament, the well-known McVeigh repair for adult hernias, is controlling, if we look at the anatomical orientation, will be controlling both the inguinal type of hernias and the femoral type of hernias. It's very important to understand the anatomical configuration of the areas in order to have a better performance and results during surgery. The myopectineal